ZeiViral, smart health medication errors kill over 1.3 million people every year. A silent tsunami striking homes without warning. Medication errors kill more than 1.3 million people worldwide every year. A silent tsunami sweeping through homes without notice. This tragedy happens because 95% of people make fatal mistakes when taking medicine, from doubling doses by forgetting to mixing drugs that explode inside the body. What should be a cure becomes a deadly trap, and the worst part, you may be just one step away from it. The reality is brutal. Even harmless drugs like vitamins cause 100,000 hospitalizations every year due to dangerous interactions. A study revealed that 7 out of 10 patients cannot distinguish between generic and brand names, leading to accidental overdoses. This is not a distant problem. It has a risk lurking in your medicine cabinet right now. And the knowledge you lack may be the only barrier between life and tragedy. Doctors have only 11 minutes on average to explain complex treatments, leaving gaps that lead to disasters. But now, we will expose what they don't have time to detail, strategies that will turn you into the guardian of your health. In the next section, get ready to discover the questions your doctor expects you to ask, but that 90% of patients never dare to. What you learn here could save your life. The hidden danger in medicine cabinets. Medication errors affect 1.5 million people every year in the United States alone, 1/3 of them with permanent consequences or death. This silent tsunami happens inside homes, where medicines meant to protect become deadly traps due to ignored details. The false safety of if the doctor prescribed it, it's safe hides risks that few see until it's too late. Real cases shock. A 72-year-old man accidentally took twice the dose of his blood thinner after confusing times, resulting in a brain hemorrhage. Another patient mixed an antidepressant with an over-the-counter cough medicine, triggering cardiac arrest. These tragedies are not exceptions. They are direct consequences of lack of knowledge about interactions, dosages, and storage. And the worst, 80% of people believe that reading the leaflet is enough. But package inserts omit critical risks and use technical language that 90% don't understand. This collective blindness makes us vulnerable. But what if I told you that the secret to avoiding these disasters is hidden in the packaging itself? In the next section, we'll decode the codes the industry doesn't want you to understand. Decoding your medicines, what the leaflet doesn't say. Did you know that 40% of accidental overdoses happen because people confuse drug names that look alike? Propranolol hydrochloride and propranolol hydrochloride plus hydrochlorothiazide may sound similar, but the second combination can cause cardiac arrest in hypertensive patients. This invisible trap is in every pharmacy, and you've probably walked past it without realizing. The industry hides secrets in the details. Excipients like lactose can trigger anaphylactic shock in allergic people, while food interactions even include grapefruit, which turns cholesterol drugs into toxins. A study by the FDA revealed that 65% of patients don't know that expiration date refers to the unopened product, and opening it reduces the time to weeks. These omissions turn cures into lethal risks. And what if I told you that your doctor relies on you to decode these codes? In the next section, we'll expose the questions your doctor needs you to ask, but that 95% of patients never do out of fear of bothering. Get ready to transform rushed consultations into dialogues that can save your life. What you'll learn here will forever change how you handle any prescription. The conversation that could save your life. Communicating with health professionals. 70% of fatal medication errors begin in the doctor's office, when patients fail to ask the right questions. Your doctor expects you to question, but 9 out of 10 leave in silence out of fear of bothering. This silent omission creates a gap between prescription and reality, turning treatments into minefields. What you don't ask can kill you. The 3 questions your doctor must hear. Which side effects would send me to the ER? Does this medicine interact with my breakfast or other drugs? Is there a safer alternative? Prepare by bringing a list of all medications, even vitamins. Write down answers in real time and record consultations if allowed. If the doctor seems rushed, say, "I need 2 minutes to save my life." Does that change anything? And when multiple medicines come into play, the risk multiplies exponentially. In the next section, we'll expose the ticking time bomb of polypharmacy, how harmless combinations can trigger organ collapse within hours. Get ready to discover why 5 pills may be more dangerous than 50 and how to disarm this trap before it's too late. When multiple medicines become a time bomb. Seniors taking 5 medications are 88% more likely to suffer a severe adverse reaction, and 30% of hospitalizations at this age are caused by polypharmacy. This silent phenomenon turns safe combinations into explosive cocktails. An antihypertensive plus an anti-inflammatory can cause kidney failure, while antidepressants plus blood thinners can trigger brain hemorrhages. The worst part, 70% of these patients don't even know they are at risk. Identifying hidden interactions requires extreme vigilance. Example, grapefruit juice cancels the effect of 85 medications, and antacids reduce antibiotic absorption by up to 70%. The golden rule: if you take more than 3 drugs, ask for a quarterly review. Use apps like Medscape to check interactions, and never mix prescriptions with natural remedies. St. John's wort alone cancels birth control pills and antiretrovirals. But organizing isn't enough. You need to defuse the time bomb. In the next section, we'll expose the storage mistakes that 95% of people make, from keeping medicines in the bathroom where humidity destroys formulas to leaving painkillers in the car heat turns them toxic. Get ready, your medicine drawer may be a minefield. Medication storage, mistakes almost everyone makes. 95% of people keep medicines in the most dangerous places in the house, and the bathroom is the worst of them. Shower humidity destroys 70% of the effectiveness of antibiotics and blood pressure pills within weeks, turning cures into placebos. Even indirect sunlight in the bedroom degrades vitamins and hormones, creating toxic compounds your body doesn't recognize. Your medicine drawer may be a chemical time bomb. Temperature is critical. Drugs exposed to above 77 degrees Fahrenheit 25 degrees Celsius, such as in the car or kitchen, lose potency in 48 hours. A study revealed that insulin stored in the fridge with vegetables partially freezes, becoming useless. For safe disposal, never throw medicines in the trash or toilet. This contaminates rivers and harms animals. The correct way is to mix them with used coffee grounds or soil in a plastic bag and take them to collection centers. But what if I told you that proper storage is only half the battle? In the next section, we'll reveal foolproof techniques to never forget a dose again, even with 10 different medicines. Get ready. What you'll learn about medication adherence will revolutionize your routine and save lives. Never forget a pill again. Foolproof adherence techniques. Missed doses cause 125,000 deaths every year in the United States. A silent trap that affects even those who consider themselves organized. Apps like MediSafe and Mango Health have revolutionized this scenario. They send personalized alerts, track interactions, and even notify family members in case of failure. But technology is only half the solution. The secret lies in creating unbreakable mental triggers. Link medicines to daily routines. Take your morning pill always after brushing your teeth and your nighttime pill with tea. For complex schedules, use color-coded pill organizers and alarms with specific names. Antihypertensive, 8 a.m. with breakfast. If you take 5+ drugs, divide them into groups. Before lunch, digestives, and at bedtime, sedatives, reducing cognitive load. But what if the medicine itself causes harm? In the next section, we'll decode the warning signs that 90% of people ignore, from tingling hands to strange dreams. Get ready to recognize the side effects your body screams, but you've learned to silence. What you discover here could prevent an emergency. Warning signs, identifying adverse reactions in time. 30% of hospitalizations due to adverse reactions occur because patients ignored harmless symptoms that were actually warning signs. Common effects like mild nausea or a passing headache are normal, but the danger lies in the silent signals. Sudden tingling in the extremities may indicate neuropathy, while unexplained dark urine points to liver failure. Your body cries out for help before the emergency. Do you know how to listen? Differentiating allergy from side effect is vital. Swelling of lips, tongue, shortness of breath, or hives spreading within minutes require immediate emergency care. Meanwhile, dizziness when standing up or a dry mouth is generally tolerable. Keep a strict diary. Note medication time, symptoms, even vivid dreams or change in taste and intensity. Patterns like I always vomit 2 hours after the antibiotic reveal problems doctors may not connect. And what if I told you that your diary can predict disasters before they happen? In the next section, we'll expose the deadly trap of over-the-counter medications, the ones you take on your own that cause 40% of dangerous interactions. Get ready. The false sense of safety from a pharmacy can be more treacherous than a complex prescription. Over-the-counter medicines, the false sense of safety. Did you know that OTC drugs cause 100,000 deaths every year worldwide? Dipyrone, considered harmless by many, triggers a granulocytis, a drastic drop in white blood cells in 1 out of 1,000 users, while anti-inflammatories like ibuprofen cause 65,000 digestive hemorrhages annually. This false security of no prescription needed hides a brutal reality. OTCs are just as dangerous as controlled medicines when misused. Self-medication is a silent trap. Taking painkillers for constant headaches may hide a brain tumor, and antacids for chronic heartburn can mask esophageal cancer. Worse, 80% of people don't know that a simple cold medicine with pseudoephedrine plus an antidepressant can cause a fatal hypertensive crisis. Even iron supplements interact with thyroid hormones, canceling entire treatments. And what if I told you that the greatest danger is in the combination you don't even imagine? In the conclusion, we'll reveal how to transform all this knowledge into a personal defense system, strategies doctors don't teach, but that make you the true guardian of your health. Get ready. What comes next will give you the power few patients have. Becoming the guardian of your own health. 90% of fatal medication errors could be prevented with the strategies you've just discovered. Reviewing your medication list every 3 months, using alert apps, and keeping a symptom diary are not just tips, they are shields against tragedy. Every detail you write down, every question you ask your doctor, every pill you store correctly exponentially multiplies your chances of survival. Share this knowledge right now. Show your father how to organize colored pills. Teach your mother how to differentiate allergy from side effect. Send this video to your friend who self-medicates. Creating a family safety net can save more lives than any hospital. When everyone watches out, the risk of overdose drops by 70%. Sharing is not just information, it's an act of love. But here's the final secret. The journey doesn't end here. Download our free ebook decoded package insert with 50 dangerous interactions nobody tells you about, and join our Telegram community where doctors answer questions 24/7. Because true power is not in knowing, it's in acting. Your life and that of those you love depends on it.